People who didn't have insurance, which were most of the people living in Watts, had to go to the public hospital, which was quite often a 12-hour bus ride.
5 o'clock in the predominantly black South Central Park.
Health services were just really not accessible.
A night of anger for residents of the black community.
If someone offered somebody an opportunity to go into Watts at that point in time, the time of the riots, that looked like an incredibly daunting task. Dr. Tranquata and some of his colleagues put a program together that has sustained itself.
We individually and collectively really need to pay more attention to the community.
If the environment around you doesn't support your well-being, what kind of decisions are you going to make? We use research and analysis to demonstrate impact.
We define health very broadly. We see this not just about making sure that people have health care coverage. It's about wanting people to live healthy and productive lives and reaching their potential.
In a population that lacked accessibility and continues to be burdened by chronic disease. We're still dealing with the effects of somehow this perception that communities of color and low-income communities don't have the resources and therefore are not interested in healthy food.
Is that about 20% of cancer diagnoses are caused by people being overweight and obese. Like the communities that organizations like CHC works in to make sure that we're connecting with those organizations, but there've got to be people at a local level that really understand exactly how that plays out in those communities.
CHC was the leading force in bringing about the Fresh Works Fund.
Morning, Inglewood! If they want to pick up a head of lettuce to make a salad, they shouldn't have to get on a bus. It's a story about bringing fresh, healthy, affordable food into communities that need it most.
CHC has enrolled over 40,000 children and adults in comprehensive health care.
I've been working very closely with community health councils for more than 10 years. They're one of our most vital community partners. We recognize as a public health department that we're not going to be successful if we're working independently to try to improve the health of Angelenos. We really need strong partnerships, and CHC has really been a countywide leader.
It's worth taking a minute for us to thank CHC and in particular for the work that they've done on tobacco control, because we know how very important that is.
Inglewood Oil Fields is the largest urban oil field in the country. CHC has been involved in lawsuits and has been really on the forefront of the issue with regard to fracking and the impact on an underrepresented community comprised primarily of people of color.
USC and community health councils have been involved in a working relationship going back to 1999. Academics think because of their training, they know what needs to be done and what the problems are. Community-based research says it's a more organic process. The community has expertise too. Community expertise needs to be at the table from the beginning as opposed to just kind of rubber stamping something at the back end.
The Community Health Council is a very effective communication tool for the needs of South Los Angeles into the policy world.
We want to make sure that policies that support the living conditions of this community are relevant.
They've been able to engage a very diverse set of stakeholders, everything from small kind of mom and pop community-based organizations to organizations that have multi-million-dollar budgets, elected officials at the state, local, and national level around the issues of South LA.
Part of our work is that we need to ensure that we stay collaborative, that resources are brought into the community so that real community transformation can take place.
We have to make sure that CHC is a sound, healthy organization in order to provide the services that South LA residents are really relying on.
We have the next 25 years to look forward, and that's the priority for us to do right now.